My name's Amy, and let's see, my number one was I have trigeminal neuralgia on the left side of my face, so I have a lot of pain. And I had surgery, microvascular decompression surgery, and it didn't work very well. So I still have pain. It's under control with a med for the most part, but the meds make you feel awful. So I see a neurologist, and I of course saw a neurosurgeon for the microvascular decompression. 3 years ago, before the surgery, it was anything, wind, hair, just everything. After the surgery, with the help of the meds, it's not so bad. It's cold, will usually set it off, and it's pain usually in my cheek and my lower jaw. Once every couple of weeks I'll get a lightning strike, which will pretty much like knock me flat on my knees. Just, it's hard. So like it's like getting hit with a lightning bolt. 4 or 5 is a normal everyday, because the pain's almost always there. But for the lightning strike, it's a 10 out of 10. You know, if it could be more, I would make it more. It's bad. Okay, second on my list was fatigue. I am constantly tired. I've had 2 sleep studies, including an all-day sleep study for napping. I can't sometimes do anything during the day. I'm just so tired. Sometimes it's hard for me to fall asleep at night. At the same time, I can fall asleep at the drop of a hat during the day. It's really hard to get through life when you're just so tired all the time. I've had days where I've slept 24 hours just right through a day. So 0, and even with 24 hours sleep, it's minimal. So, you know, I just never feel rested at all. They said I have hypersomnia, mild hypersomnia, which just means, or I'm tired all the time is basically all it means, which duh. And they've started me on a stimulant to kind of try to help me get through the day without falling asleep. It's not really all that helpful, so I just drink a lot of caffeine and keep going. So the third one is neck and shoulder pain. I've always been tense, but I didn't realize how badly it hurt until recently with pushing on it or anything like that. But if I twist my head wrong, all of a sudden the right side of my neck will like be twingy. Right now it even hurts really bad on the right side, or the left side, sorry. But I mean, it's like a 7 or an 8 when it's really bad, but normally it doesn't bother me too much, so probably a 3, 4. The neck and shoulder pain's probably been the last several years. My back pain, I would love for that to be gone, but I've broken my back in the middle. I have sciatica in my lower back. I also have some degenerative disc issues. I have a lot of back issues. I fell down the stairs several years ago, about 12 years ago, I fell down the stairs, no, 10 years ago, sorry. 10 years ago, I fell down the stairs and broke the middle of my back, which is kind of a weird spot to break your back at. So I constantly have kind of some pain going on in my back. You know, on a daily basis, probably more like a 4. When it's really bad, probably a 7, 8 out of 10. Normally I can kind of just live with it. A lot of my things I just push through. So, you know, that's my back pain. So it's okay. It's not the greatest, but it's all right. Let's see, and I've had that since my early 20s is the first time that I pinched my sciatic nerve. I was holding my daughter, and I was coming down the stairs, and my feet I lost my balance. I went, my feet came out from underneath me, and I went bumping down the slide or the stairs, and I thankfully ended up holding onto my daughter long enough to get to the bottom and then set her down. But I'm a klutz. I'm a known klutz. I walk into things. I trip going upstairs. I have a lot of balance issues where it's just known in my family that I'm just going to bump into something. Oh, years, probably since my 20s, maybe even before that. I just not very coordinated. So Headaches. I've had my headaches since I was in my teens. I'm 43. So migraines more as I got older. Yeah, it's all around in here. It'll hit me on the left side. It'll get behind my eye. But it's like a halo just sort of strangling my head. So I have seen a neurologist again, and I've been on meds, all sorts of different meds to try and help it out. I finally actually just came off of 2 of them because I'd rather live with the pain than the fogginess and the series of dumb mistakes I was making. Generally, the pain is, when the migraines are bad, it's 10. When they're not so bad, when it's just a, background noise, when it's just, starting to hurt kind of thing, it's 3, 4. So, but it can get bad. Once every couple weeks. So, I've got it a little more under control now. But daily headaches, daily kind of problems, but. Oh, I've seen so many. I've seen chiropractors, I've seen neurologists, neurosurgeons, my regular doctor, just my everyday doctor. I have seen, I'm trying to think, I've seen physical therapists, I've seen, I've seen a lot of doctors. I also saw a doctor, an ENT. I had a deviated septum, and I had that fixed. So I had that surgery a couple of years ago. It kind of helped a little bit more with the breathing, but not a whole lot. So I've seen an ENT a couple of times for ear pain on my left ear. And then I chalked it up to just the trigeminal pain because that sometimes can affect the ear. It's nothing that I can do. There's nothing that seems to be able to stop it when it does hurt. So I saw an endodontist because I thought it was my teeth that were bothering me. So my dentist gave me an endodontist to go see. And I went to the endodontist, and they said, it's not your teeth, it's your jaw. They took a look at everything, and they said, we can't, that she would feel bad about doing any root canals or anything like that because it wouldn't be effective. It's just my jaw. So probably around 2011, 2012, I was having some joint issues, especially my hands, plus my back pain and everything else, and I had some stomach issues, and but the joint pain was really bad. And so I went and saw a rheumatologist who said I didn't have anything, but suspected fibromyalgia. Go back to my regular doctor. My regular doctor says, yeah, that's probably it. You should probably go to the Mayo Clinic because they have a really good program there, and they can see about your hands too. So I went to the Mayo Clinic in 2017 and got my official diagnosis there. Mostly my wrists and my hands, they would get really bad, and my knuckles make this weird clicky poppy thing when I move them. Right now my wrist is bothering me, and the x-ray showed nothing wrong with it. However, I got some exercises, PT exercises and whatnot for it. That started hurting a couple of weeks ago. So once again I thought, it's probably fibromyalgia, but it's a background diagnosis because it just kind of seems to cover the tiredness, the aches and everything, and so it's kind of like I don't know, it's like a whole diagnosis that covers a whole bunch of different things. I had a regular doctor, I saw a gastro doctor, I saw the hand clinic that they have there, and I went to their fibromyalgia clinic that they have for 2 days. So I went to their fibromyalgia specialists. Pressure points, they also did the x-rays or CT scans or whatever it was. It might have been, I don't know what it was that they did, trying to make sure that I didn't have anything else. Checked the same thing the rheumatologist checked. They were pretty thorough. So, and then it all came down to I have hypermobility in my wrists, and my hands and my fingers, and then fibromyalgia. I'm doing significantly better. As far as the trigeminal neuralgia, I've had like 2 or 3 kind of pains, very mild, but other than that, like The dull pain's not there. The trigeminal has improved like 80%. I'm really hopeful it stays that way. That alone's been worth the last week and doing this. I was not expecting the TN to be fully, or at least this significantly taken care of. I expected to still have, more pain than I am currently having. That was pretty much it. When I went and had the MVD surgery, I was told that this should help, but I was basically told unless I go and get the nerve, deadened, that I was just gonna have to live with it. Energy, I have an improvement with my energy, mostly with stamina. I'm able to kind of keep doing things a little longer than I used to. I used to have to take breaks every 30 minutes and sit down and then rest, and then I could get back up and do more stuff. And I've noticed that this last week I can actually keep going a little bit longer. So that's nice. I'm like 40%. Lower back pain, oh my God, that's significantly improved. It still hovers around a 2-3. It was a 3-4. I haven't had any major back pain. So that means no laying in bed with my TENS unit or muscle relaxer, pain pill or anything like that. I haven't had to do any of that, lay in bed. So that's like really big. 25% better. Headaches, migraines. I haven't had a migraine this week. I've had 2 smaller headaches. So, and I used to have, I had a lot, 3-4 a week, and sometimes the intense migraines. So far, 2 mild ones. Yeah, that's a good 20-25% improvement. Okay, the balance is funny. My balance is like 100% different. It's significantly different. The other day I was cooking and I do a lot of running up and down the stairs to the downstairs freezer, and it was definitely eye-opening because I wasn't tripping going up the stairs, and I could run down the stairs without having to hold on or grasp something really quickly. I just felt very stable. So that's been very nice. Had no expectations about balance. That was not even, we just took it that I was a klutz. And so that wasn't even on my radar of things that could be fixed or changed. Yeah, overall, this has been like phenomenal. Like a very different week from last week, So it's been the 6 weeks. I'm doing much better. I'm having about 90%, 95% less pain in my face from my trigeminal neuralgia. I haven't had one lightning bolt shock, which is really good. I usually have them at least once every couple of weeks. So, I should have had a couple of by now, and I haven't, so that's good. Second one was energy. My energy's okay. It's up, higher than it was before, but it's 40%. I've still got some sleep stuff that, is gonna affect how tired I feel. My neck and my shoulders are much better, probably 60 to 70% better. I don't have nearly as much neck and shoulder pain as I did before. My lower back is much better, probably also right around 70%, 80%, somewhere around in there. I've only been laid up once in bed, and typically in about 6 weeks it would have been at least 3 times. And I've only had one time, and I was actually really pushing myself too far, and even I knew it. But let's see, my headaches have gotten much better too. I used to get them a lot more frequently, and I still get them, but they're not as severe. So, they went from like 5, 6, 7 pain-wise to like a 3, 4. And I've only had one small migraine with a little bit of nausea, and that's it. So, and typically I would have a couple by now, so after 6 weeks, so that's very good improvement. What's 50, 60%, maybe 70, kind of, depending on the extremity of it. My balance is like 100% better. I think I said that even a month ago, right after I had these put in. I went from falling up the stairs all the time, like tripping over myself, to not at all. I haven't fallen down or tripped down up the stairs in 6 weeks since I've had them put on, which for me is fantastic. I'm known as the family klutz, so this is great. Everything's going good. Everything's going great. My expectations, they were low. I was really hopeful. I think that was probably the biggest part about it, is I was just very, very hopeful that it would make an improvement. And that's probably where I sat, was, you know, I didn't think it would change a whole lot. It did. You can tell by the CT scans, my neck's straighter, and you can tell by, I mean, there's so many improvements that aren't just feeling in my jaw and where it's at, and there's just so many, and like there's the space right here is opened up, and oh, so the palpation. When you go and touch and feel, the first time around I about jumped out of the chair and kicked him and Melissa, and this time around it was, I went from like what, 105 to 30 on my pain rating thing, which I mean, literally I was jumping out of the chair 7 weeks ago. So this big, huge difference.